Knees. What are you doing for knees? People with severe knee pain, maybe they were even told you need a knee replacement.
Mm-hmm. So there's several things nowadays with knee replacement. So sometimes maybe the doctor tells you need to lose weight in order to do your knee replacement, but you're in so much pain, you can't lose weight because you can't exercise.
Okay.
So you start getting, you feel sad, you don't sleep well, you tend to eat more, you gain more weight. You're doing the opposite and you need knee surgery. So what can we do for them? So most patients have heard about knee injections. You hear these injection mills where you get steroid injections once a month. Not a very good outcome. Sometimes you can get the gel injections into the joints. That sometimes can help for a little bit. And now we have this. We have a couple of things. One is called a genicular knee ablation. Very quick procedure. It takes about 3 minutes in the office to do. I kind of sap that nerve that's producing the pain from your knee, and I kind of short circuit it so it doesn't go to your brain. You can go to water therapy, you can do physical therapy now that you don't have that pain. And then if you need to, you can go to surgery. Or let's say you're 85 years old and you've already had your knee replacement and you're not a very good candidate for surgery again. So
But you're still having pain.
But you're still having pain, right? Just because they change it doesn't mean you're not going to have pain. And so you have your function, but it hurts. So we can do a knee ablation in the office. You come in.
When you say knee ablation, so you find the nerve that's causing the pain.
Absolutely.
The signal to brain.
Exactly.
You heat it.
You heat it.
That's the ablation part.
That's the ablation.
And that kind of freezes or numbs the nerve.
That numbs the nerve for about a year.
And no pain.
No pain. And
what about bone on bone?
I can still denervate it so it doesn't have any pain. Now, if you have bone on bone, you should get that probably and then go see your orthopedic surgeon, because when you have the surgery, it doesn't hurt as much either.
Okay.
And then we also have something interesting, which is called a peripheral nerve stimulator. And a peripheral nerve stimulator is you put these two leads right on top of the nerve, and you have an external stimulator, and it will jam the nerve signal to your brain, and it tells you no more pain. And you're able to do your activities.
So like what, ultrasound or electricity?
It's electricity. It's not ultrasound. It's just
goes to these two nerves.
Goes to these three nerves.
Three nerves.
Because there's four, but you want to leave one just in case you hit yourself with the table at night when you try to go to the bathroom.
I got it. Okay.
So you're not numb all the time. So you can still feel some pain, but you're able to do your functions back, right? Whether like we said earlier, anything that you enjoy doing. So let's say you enjoy going fishing, or you want to go fly fishing, but you can't because of your knee pain. Well, we fix that up for you. You can go fly fishing.
And this is not to be confused with things like injecting the knee with PRP.
Exactly.
Right?
That's different.
That's totally different.
That's totally different.
Which is what's being done by a lot of the nurses or
Exactly. And sometimes they do the PRP and they choose the wrong patient and they don't have a good outcome.
So this way you just ablate the nerve.
You just ablate the nerve.
You heat the nerve.
Or you jam the nerve with a peripheral nerve stimulator.
Or you electronic stimulation.
Yes.
And so they don't have the pain.
And they don't have the pain. And
would you say thousands of people in New Mexico could...
Tens of thousands on this.
And they're just not...
Remember, you got two knees, right? So
they just don't know about it.
You just don't know about it. And
really?
This is something that is...
Insurance covers it, or this is out of pocket?
Everything that I tell you is covered by insurance.
Okay, good.
Yeah.
But they have to see like an interventional pain physician,
yes,
or somebody that this is all they do.
Exactly.
And so athletes can do this?
Athletes
younger, older?
Anybody can do it.
But what if you're in your 80s? Too late for that?
No, this is the best thing to do if you're in your 80s, because as you know, if you're in your 80s, you're probably not a good surgical candidate. You're not going to recover from a big knee replacement. So you do this and you give them their function back.
Have you had people scheduled for knee surgery and now?
All the time.
All the time?
Yes, all the time. They lose weight, they feel better, and they don't come back because now they lost weight, so their knee doesn't hurt anymore.
Interesting.
Same thing with hips, right? We suffer from the big obesity pandemic that we live in now. You lose the weight and you start feeling better, right? Your self-esteem gets better.
So hip pain, things like that?
Yes.
Some of these can be handled by heating the nerve, doing ablation.
Exactly.
Or injecting.
Or injecting with PRP.
Okay.
Or that's not covered by insurance.
Okay.
Or you can do the stimulator.
So the spinal cord stimulator or a stimulator for the knee.
And that's called a peripheral nerve stimulator, because you're not putting in the spinal cord, you're putting directly on that joint. You can do the peripheral nerve stimulator for the knee, for the SI joint. A lot of patients have SI joint. I don't know if you're familiar with that.
No.
That SI joint is in your lower back where your sacrum and your ilium come together. It's a big joint. It's a crappy joint. Women tend to get pain there all the time after giving birth. So 20, 30 years later, they're still having pain. You can do a peripheral nerve stimulator there.
And it works.
It works, and it works great. And it's a minimally invasive procedure. It takes about 20 minutes. You can do that for SI joints. You can do that for shoulder pain. Okay, it works really well for shoulder pain. Minimally invasive procedure too. The patients that have abdominal pain after having a hernia repair, sometimes they damage the nerve, and you can put one in there and, walk out of 15 minutes and you're done.
And again, they can call you directly.
They can call
You don't need a
direct.
referral from your
You don't need a
primary
referral.
care physician.
Nope.
Okay,
Just
good.
ready to go. Just call us, email us, or text us.
But especially on the second opinion. Like if somebody
Yes.
says you need a knee replacement, at least get a second opinion.
Yes.
Is that your belief?
Yes, get a second opinion. Let's see if we can help you or not.
And you work together with the local orthopedic
I
surgeons
work with the
or
orthopedic surgeons.
neurosurgeons, et
I
cetera.
will tell you, this is not going to work for you. You need to think about the surgery. And I do that often. I can fix this and that pain, but I can't fix that. You need to go to
So
the
if
surgeon.
Dr. Gonzalez says you need surgery, you need surgery.
You probably do, because that would be your second opinion telling you need surgery, right?